Hi, my name is Jessie, and I am a physical therapist assistant with Women's Advantage Physical Therapy.
Hi, I'm Christina Vivit, and I'm a physical therapist at Women's Advantage Physical Therapy as well. And we are here today to talk about ball health norms from a research standpoint, but also a clinical lens too. So let's dive right into that. So, our first study that we have here is called Exercise Therapy in Patients with Constipation, and it's a systematic review and meta analysis of randomized controlled trials. So, this study is a study that takes a collective group of studies that are looking at the effects of exercise therapy for constipation. And so with constipation, so let's just open up with prevalence. So constipation is pretty prevalent amongst our community, not only within the clinic, but also just in general for people. And so it's estimated about 0.7 to 29.6% of people have struggled with constipation or are currently struggling with constipation. And so with that said, constipation is more prevalent in women than it is in men. And so with constipation, per this study here, not only can it lead to sleep orders, but it can also be accompanied by anxiety, depression, increase the mortality associated with hypertension, cardiovascular, and cerebrovascular diseases, as well as the incidence of colon cancer. So it's largely a public health issue that lots of different providers have hands-on, but definitely you as an individual should also feel empowered as to what can you do to help yourself, and also be aware of some of these behaviors that can lead into constipation patterns and things that are modifiable risk factors that you can be more aware of today. And so let's talk about this study here. So again, this study is a systematic review and meta-analysis of randomized control trials that look at the effects of aerobic exercise and anaerobic exercise on constipation. So when thinking of aerobic exercise, the study is primarily looking at things like walking, Tai Chi, and anaerobic exercise would be resistance training. Now, the study selection criteria, not only did we mention earlier randomized control trials, but also study selection criteria. The participants are all adults, so 18 years old or older, diagnosed with non-drug or disease-induced constipation, and patients who are able to exercise without assistance, and the time and type of exercise interventions are also considered in this study too, to fit the categories of aerobic and anaerobic exercise. So exclusion criteria, so those that were excluded from this study include patients with mental illnesses or cognitive disorders, as well as women who were pregnant or recently gave birth. So a total number of 680 participants from the 9 studies met the eligibility criteria and were included in this systematic review and meta-analysis. And so 8 studies involved aerobic exercise, while 1 only involved anaerobic exercise. And so pretty much what this study was looking at, again, was the effects of anaerobic exercise on constipation. And so how they were measuring constipation, they were measuring it in a weakness of this study. All research studies have their weaknesses, but particularly in this study, a weakness is the heterogeneity of the studies, meaning that each study is not the same and that they're not evaluating the exact same things in the exact same way. So to come to conclusions from a research study with appreciating the fact that there is heterogeneity amongst the studies, that can be something to consider when we are leading to conclusions with a research study. So how each of the studies measured constipation was a little bit different. but in general, they measured them in the frequency of bowel movements, stool consistency. So was it rocky? Was it soft in form, more on the liquid end, which is stool consistency, as well as the need for taking other laxatives or stool softeners in order to help with bowel movements, um, and the dependency on that. So those are just the different ways that these studies measured constipation and how exercise had an effect on assessing constipation. So overall, this study suggests that aerobic exercise is one of the best forms of exercise to manage constipation. Now, obviously, exercise is just a small part of the pie of what makes up good management for constipation, because there's a lot of other things going on. And then another bias in this study is that even though it did recommend that aerobic exercise is one of the best things that you can do for constipation, most of the studies included in this study are looking at aerobic exercise versus the one study that was looking at anaerobic or resistance training exercise for the management of constipation. So we have a little bit of bias there in a sense where we have more exercises coming through as aerobic exercise for the purpose of constipation and looking at those things. So that can be something to consider when evaluating these study results. And so primarily for the aerobic exercise, we're looking at walking. Walking did improve the symptoms of constipation in comparison to usual care and normal lifestyle, in conjunction with the improvement in stool consistency and bloating was also better in the aerobic exercise group. And then overall, what we have here, so with the Tai Chi, so the Tai Chi also in this study in particular included in the meta-analysis, 12 weeks of Tai Chi significantly improved the symptoms of constipation. So thinking about the nature of access, with aerobic exercise, so something as simple as walking, or if you live in an area where walking might not be the most accessible, safe form of exercise within your home, something that you can do is, just like in this study, they suggest Tai Chi. So if Tai Chi is your thing, you can try out Tai Chi. You can look up videos online. You can even come up with your own exercise and just move how your body wants you to move for, a period of 10 to 30 minutes to get that heart pumping and get that aerobic nature of exercise in order to help with your constipation, because per the study, aerobic exercise is one of the more recommended forms of exercise to get your bowels moving. And yeah, I think that's pretty much it for this study. What do you think, Jessie?
I think that's great. And we can talk a little bit more about exercise and the stool consistency matter that you talked about earlier.
Mm-hmm. And I think another thing to add, so physiologically, with the physical activity and aerobic exercise and how it can affect constipation, per this study, it mentions that due to the effect of exercise on colonic motility, accelerates gastrointestinal transit. So pretty much, in other words, exercise helps with stimulating that reflex and trying to get things to go. And gives it that kickstart, and also increases the stimulation of the abdominal muscles to thereby help stool move into the rectum. So something that we do a lot is core strengthening, especially with those who have bowel issues in terms of constipation or even incontinence, because it does help with increasing that movement and facilitating that activation of that reflex and movement of stool into the rectum. So
not only that, but the quality of life also seemed to be better for people who were diagnosed with irritable bowel syndrome, and after 24 weeks of aerobic exercise. So another side benefit of doing some aerobic exercise.
mm-hmm. Anything else you want to add,
I
Jessie?
think that's good for that study.
Okay. So moving on to the next study, we have the perspective on physical therapist management of functional constipation. And so this study looks at the perspective of the physical therapist and how we can help those with constipation. And so the study goes into the different types of constipation. So what I like to explain to patients is that with constipation, sometimes it's not always a gut issue within the stomach and then the colon, but sometimes it can also be an outlet issue too, where at the outlet, so outlet meaning the anal sphincter, pelvic floor muscles being that gatekeeper to keeping us dry when we want to stay dry, but also letting us go when we want to pass urine and stool. And so sometimes constipation can be an outlet issue where we're having a harder time passing stool and we're getting back up because at that outlet in the pelvic floor muscles, we're either not getting that lengthening and opening as nicely to effectively let everything out, or it can be a coordination issue where we're trying to bear down passive bowel movement, but instead of those muscles lengthening and opening, we're getting a tightening instead. Or what can also happen too in that sense is poor communication with, if this is your abdominal wall and these are your pelvic floor muscles, and for successfully passing a bowel movement, we want both of these parts to communicate effectively so that they can communicate to get your stool out in a easier, more biomechanically efficient way, where we have pressure coming through from the abdominal wall and in and down pressure toward the pelvis, and then lengthening of the pelvic floor to effectively let your bowel movement out. Now, sometimes, and what this paper looks at too, is the different types of constipation and how physical therapists can manage this. So let's say, someone's coming in with constipation and we look at their bowel mechanics, how they're pushing. Sometimes what you can see is, let's say they're pushing, and then all of a sudden the pressure is coming out this way instead of in and down toward the pelvis. So that right there could be a communication issue with the belly and the pelvic floor, where that pressure system isn't working as well, in a sense where our pressure is being directed outward this way instead of in and down into the pelvis. So you're going to be sitting there and straining forever. So that could be an example of not only a miscommunication with the abdominal wall and the pelvic floor to get your stool to come out, but also an outlet dysfunction issue where the pelvic floor muscles are inhibiting the release of the bowel movement based on those mechanics. So I kind of went off to a tangent there.
That's okay. We can go look at the image here and talk about what you just spoke about while sitting.
So go ahead, Jessie. You can share a little bit more about that.
Let me share that picture with you. Okay, we have an image here. So this talks a little bit about what Christina spoke about earlier, about bowel norms. We wanted to go normally between once a day to once every 3 days is about the normal things. Different picture pulled up than I expected, but it's okay. We'll stay on this one. Signs of constipation. How do you know if you're constipated or not? If you had less than 3 bowel movements a week, probably want to check in, see what's going on. If something's lumpy or hard, that's probably a good indication. And if it feels like you're not quite everything has been out, that's probably a good indication that there's some constipation going on. Causes of constipation. What could cause some of these things? Sometimes we're eating foods that are different. We just came back out of Thanksgiving. So things that we don't normally eat. Foods that don't involve a lot of fiber. If we're dehydrated, oftentimes that'll do it. Like a physical activity, research just showed us that aerobic exercise does help. Irritable bowel syndrome, ignoring the urges. Sometimes we're in a rush and we want to get to wherever we need to go to, so we ignore the urge and then we feel it somewhere else, and I really don't want to use this public restroom, so we just continue to ignore it, and all that just creates a little more backup. So
can I add to that too, Jessie?
Yes.
So that's a good point, because with ignoring the urge to go to the bathroom, like if you're shy at your workplace and you don't want to poop at work, or if you're a student and you don't want to poop at school, that can not only suppress the urge to go, but also develop into constipation issues later, because when you're regularly suppressing that urge to go, your system isn't going to be as sensitive anymore, sending those alarm signals to you to have a bowel movement, because over time you keep suppressing it, which then almost retrains your system to hang on a little bit longer so that you're not feeling the urge to go because you've been suppressing it for so long, which can then lead into constipation issues. So that's something to think about too, because it's common, like nobody wants to go poop at at school or at work or in public places, but
Right.
yeah, just
Or what's the common thing when you're at work? You always courtesy flush, right? Because you don't want the smell to last for long periods of time. But how do you know what your stool really looks like if you're constantly doing the courtesy flush?
yes, that's another thing too.
So, what are good things to stimulate bowel movements? How about drinking a little bit of hot or warm water in the mornings? Eating a regular meal nice and slow, using a funnel. I really like this image here. So we call this the I love you massage. So you start with the I. So if the head of the person is here,
I
so
think, Jessie, we're on the toileting handout still. Do you have the picture of the bowel health handout?
I do. Let me stop sharing.
Okay.
I think the wrong image pulled up. So I just went with it.
It's okay.
Let me see if this one works. Share that one. And it's the same one that popped up.
And if anyone has any questions, feel free to shoot them to us via Facebook, or I don't know, how else are we taking questions, Jessie?
Yes, via Facebook, or we can ask any questions.
Yeah.
There we go.
I see your documents.
You see all my documents?
Well, I see your recents.
And that's all you're seeing? Okay.
Yeah, it's okay. I can pull up the bowel health handout. I have it right here. I can show it on the screen.
Oh, I'm seeing my toileting technique sheets. Yeah, that's it. Okay, great. So we're back on that bow. We're back on the massage, or are we talking same sheet?
Uh-huh.
Okay, so we're back on here. And so if you look, we call this the I love you. And so you start massaging in one direction, and you're basically trying to stimulate the bowel in the direction that the large intestines are moving in. And so just trying to stimulate a little bit of movement there. And so if my dear friend moves it, yep. So you start going from the descending colon, then you move from the transverse all the way and move your way down. Yep. And then you continue massaging in that direction. And then following Christina's finger, you start going up from the ascending colon to the transversal cross, and then all the way down. And you just gently move in that direction, applying slow pressure. You can do circular movements if you want. You can apply the pad of the hand, and you can help stimulate bowel in that sense.
There's our colon massage.
Colon massage. Good.
Okay, very good. I like that a lot. So that's something that you can do on yourself. You can do on your loved ones. You can do on your babies to help with bowel movements there.
And toileting posture is something you can work on too. There's a picture on that same sheet of paper. There's a picture of a man sitting down on a toilet.
Here it is.
There we go. You can see him leaning forward, and then you want the knees to be up a little bit higher than the feet. We love the Squatty Potty. You don't have to have a Squatty Potty, which basically just lifts up your feet. So a lot of the modern toilets are a little bit higher than they used to be. You want the feet to be up about 6 to 7 inches. And then leaning forward instead of rounding forward, you want a nice flat back here. And oftentimes we'll say, you inhale, make the belly big, make belly hard. And then as you continue to exhale, you want to think about relaxing that pelvic floor so you can let everything come out without feeling like you need to strain or push. So there's just a couple little techniques you can work on if that is an issue for you.
The knees higher than hips is also great because if you can imagine the pelvic floor muscles is like a hammock, it's like loosening the ends of that hammock to allow you to go better when you bring your knees higher than your hips. So that's why the Squatty Potty, or you can use a shoebox, you can use your textbooks if you're not reading them. You can use your textbooks, you can use shoebox, kitchen stool, whatever you have to elevate your knees, and that will help a lot too. But anyway, that was good. So back to that article, the physical therapist. Back to that article with the physical therapist management of functional constipation. This article just goes into all the different things that we look at as physical therapists. So one advantage that we have as physical therapists is orthopedically, we can also consider what's going on in the spine. So what's going on in the spine, so your spine is here, and then you have your rib cage that's attached to the spine that goes like this. So if we're only addressing what's going on up here in the belly, we're missing a whole component of what's going on back through here in the spine where the rib cage attaches, and what's housed in the rib cage is all of our digestive organs. And not only our digestive organs, but also the diaphragm that sits up top. And so with the article that we're looking at here, some of the different things that the physical therapist considers with constipation is thoraco-abdominal examination. So we just talked about earlier, we look at strength, abdominal strength, coordination. Not only, are you able to move and engage your abdominal muscles, but also what's the communication like between the abdominal muscles and the pelvic floor muscles too. We also look at thoracic and rib mobility. So your thoracic spine is your mid back. We also look at rib mobility. Ribs are attached to the thoracic spine. We look at posture. If you're in a more forward flex position, or like this, you can see how that can also impair the mobility of your spine back through here, and you're not getting as much rib cage opening, which can then lead into possible biomechanical deficits in how your mechanics would be as effective with the abdominal pressure, pelvic floor, as well as what kind of environment you're giving the rib cage and the spine to move based on posture here. Lumbo-pelvic and hip examination. So we also look at your lumbar spine, your low back, your hips. We look at movement, strength, coordination, perineal and intrapelvic exam. So as pelvic floor physical therapists, that's something that we do. We can do an internal exam of the pelvic floor muscles vaginally, rectally, based on, your appropriateness for either one, to look at the mechanics of how well are you able to coordinate those muscles with contracting, relaxing, lengthening, looking at ball mechanics. So like I said earlier, sometimes there can be an outlet issue where the patient thinks that they're pushing down and opening in the pelvic floor muscles, but maybe the muscles might be tightening instead, which is then preventing them from successfully passing a bowel movement. We look at neuro exam, so sensation of the sacral, lumbosacral nerve roots, pretty much in the lumbar spine, in the low back, and in the sacrum. They have different nerves that supply motor and sensory, and so motor and sensory necessary for having a bowel move and feeling that urge or having sensation, as well as overall your muscles' ability to coordinate that movement down there. And palpation. We palpate along the abdominal wall to feel what's going on there. Jessie talked about the colon massage. So yeah, we feel around your belly too to see what's going on there. And then overall, as physical therapists, not only from a muscular standpoint, but also lifestyle wise, we're looking at hydration, we're looking at how much movement you're getting every week. Stress management is also important for constipation and figuring out reasons as to what is contributing to your constipation. And usually with constipation, it's a multitude of different things as well. It's not always just one thing. And so one thing that you can do if you're constipated is just be more aware of your triggers and how those triggers cumulatively can contribute to constipation and what you can do about that. So I don't know. What do you think, Jessie?
Yeah, looking at eating habits, fluid intake, like Christina said, education, maybe doing a food diary on what you've been doing, um, activity level, all of that is contributing to your bowel health. Absolutely.
Toileting posture.
Stress management, like you said.
Yeah.
Awesome.
What do you think, Jessie? Did we cover it all?
I think that's about it. Yes. So thank you so much for joining us today. If you have any questions, comments, or concerns, please feel free to let us know on Facebook. We'd be happy to answer them. Thank you.
All right. Thanks, everyone.